Hello and welcome to GBA 1 Module 5. This week we will be covering an overview of dental, vision, and hearing care benefits. Our learning objectives for this week are to understand the distinguishing attributes of dental plans and the categories of dental treatment in plan design, discuss the characteristics of scheduled and non-scheduled dental plans, explain the design elements that need consideration when providing orthodontic benefits within a dental plan, describe factors affecting the cost of a dental plan and alternative elements of plan design that impact net aggregate plan expense, evaluate how various plan provisions and attributes of the covered group interact to affect individual plan participant costs as well as overall plan costs, and to discuss broadly plan coverage for vision care and hearing care expenses. We now have a basic understanding of insurance and medical plans. Moving into the realm of dental insurance has some variance from the mechanics of medical that are important to understand. For instance, the location where one receives dental services differs from where medical services are generally offered. The nature of care and the costs differ, as well as how prevention is emphasized. With respect to location, physicians tend to practice in groups, whereas dentists often have individual practices. This gives physicians the luxury of associating with one another, whereas dentists don't have such associations being so convenient to their proximity. This can hinder such benefits as getting peer-reviewed opinions and to simply control quality provided by dentists. The nature of care, cost, and prevention between medical and dental can differ as well. Dental care is a universal need, and it is fairly common for a person to seek care for their oral hygiene on a preventative basis. However, with medical, people generally go to the doctor when there's a problem that has some level of pain or discomfort. Dental treatment can be postponed if a person sees it as elective or non-life-threatening, if they fear the treatments, who likes to get a tooth drilled, right? Or if they decide they could use that money for another want at that time. Dental care is often cosmetic, whereas most medical is not. Dental care may have alternative procedures, whereas medical can be very restrictive. Costs with dental can be much lower than the average cost of medical procedures. Prevention is more salient with dental care issues, such as dental disease persists. Most medical issues have some type of resolution. The types of organizations that offer dental coverage are fairly broad and can range from insurance companies, Blue Cross Blue Shield associations, state dental associations, self-insurance, group plans, and HMO-style plans. As with medical, there are different types of plan structures. In the dental insurance world, these different structures are called scheduled, non-scheduled, combination, incentive, or plans that cover both medical and dental. The two basic types of dental plan structures are scheduled and non-scheduled. However, there are some alternative types that are variations to these two. Each has its own pros and cons in terms of specifications and design. Looking at the strategy of the organization and the health program is key to determining which type is the right type. There are 10 basic professional categories of dental expenses. They are diagnostic, where we get exams and x-rays; preventative, where we get cleanings, topical fluoride treatments, and so forth; restorative, endodontics, that's the category for the root canal; periodontics, oral surgery, prosthodontics, orthodontics, pediodontics, and implantology. These procedures are generally consolidated into 3 to 5 groupings for insurance purposes. Orthodontic care is a component of dental plans that has some specific nuances to it. It is only provided with other types of coverage, not individually. It carries a deductible and a coinsurance that is typically about 50%. They typically cover people age 19 and under. However, some plans are starting to cover adults. Implantology is another unique component. However, it is scarce in most plans due to the high cost nature of the services. This product does not apply to children as opposed to the orthodontic care. As with medical plans, the overall cost of dental is of great importance to the employer. Thus, they must be in tune with the design of the plan, how they will implement it, and the plan administration aspects. The design considers similar medical plan factors such as type of plan, deductibles, co-insurance, plan maximums, pre-existing conditions, limits, and orthodontic care. Deductibles are a critical point to having a well-designed plan. There are plans where the deductible renews each year and others where they are a lifetime deductible. Cost controls are embedded using such factors as the schedule of reimbursement fees. For instance, often plans will cover procedures such as filling cavities at an 80% reimbursement rate, whereas that fun root canal will only be covered at 50%. The design needs to consider such factors such as group characteristics in terms of age, gender, location, income level of the participant, and their occupation. Each of these contribute to participant election of having the insurance and then how effectively they will utilize it. The plan sponsor must be aware of such things as sandbagging and adverse selection. Having a good format for plan administration will bring about efficiencies, leaving rationale for the company to exist. Other factors to consider are the technology and techniques that help bring efficiencies to the overall delivery of services and the cost of the plan. Turning to vision care, it is often neglected by the employee because everyone does not wear corrective lenses of some sort. While there are separate plans for vision, many medical policies have coverage for basic services such as the exam and maybe some eyewear. There are 3 types of providers for vision care: ophthalmologists, optometrists, and opticians. Each have a different educational criterion and thus differences in services that they can provide. Vision plans usually have coverage for the exam, lenses, maybe contacts, and the frames. Plan design is dictated by the frequency of which a person can get services and the schedule of benefits. For instance, do they get an eye exam once a year, every 2 years? When do they get to replace their frames, etc.? They have been found to be relatively easy to understand, these plans. They may have a PPO network and may be part of a cafeteria plan where flexible spending accounts can be used to defray some of the costs. Hearing plans are the last of this week's learning. Hearing care is not generally included in a benefits package. However, there are some procedures that may fall under the medical plan. When a package does exist, it generally covers an exam by the procedures, audiometric testing, and various hearing instruments, such as hearing aids. Okay, on to Module 6, where we will take